a mother is aware and alert that I start physical activity for my daughter right from, she can definitely change her puberty timing. Yes.
पहले के ज़माने में they used to be like, our kids should be खाते पीते घर
खाते
का,
पीते घर का,
should be
chubby,
healthy looking, should be chubby. But now I think that has really changed.
This training works very good for all the females who have PCOD, PCOS. People think that I did cardio, it's enough.
It's the sexual health in women.
Yeah.
Right? But yet nobody talks much about it.
Correct. Painful intercourse is obviously one of the things, and it is all because of a tight pelvic.
I don't know much about garbhsanskar.
So what I hate is people think that garbhsanskar means मुझे पूरा time chanting करना है, जाप करना है, मुझे बुरे चीजें नहीं देखनी है.
Pregnancy, when should they start? How do these exercises? Where should they incorporate that?
So once you start working on your muscle strength, you start working on your DR gap, and automatically वो जो flab लटक रहा है वो फिर से अंदर चला जाएगा.
Exactly. Cesarean scar is something which is one of the most painful things.
If you massage your scar carefully after delivery, you don't let it stick or adhere to your skin, you will not have all those
during pregnancy, but even after, which we call as postpartum depression, which is very common.
She's not allowed to go down. So 40 days you are not allowed to go down.
Exactly.
जेल के कैदी जैसा उसका ये बना देते हैं, और फिर बोलते हो कि ये तो रोती रहती है.
What do you think is the importance or contribution of the father?
So I think that every husband should understand.
Physiotherapy is not just about injuries. Dr. Reema Ranka is a women's health physiotherapist, and she's helped countless women in their difficult journeys from puberty to pregnancy, from lactation to menopause. So if you're someone who's struggling to find the right answers, then this episode is just for you. So let's dive in. Hi, Dr. Reema, and welcome to the Body Talk.
Hi, Radhika. I'm so excited to be here. Thank you for calling me.
Well, great. So now you're a women's health physiotherapist.
Yeah.
I think this is a very interesting field. I don't have many people who I know who've done that. So can you throw some light on what inspired you to do this?
Okay. So first of all, physiotherapy also, I'm sure many people don't know what is physiotherapy. Physiotherapy is a science which treats you with all the diseases that you have without any medicines. So we use our superpower, which is exercises and rehabilitation, to treat you, to get you back on your toes. So it has, in every field it works. There is an ortho rehab, there is neuro, there is cardio. In today's time, every surgery that you do, there is physiotherapy that, brings you back to walking after your surgery is done. So similarly, when a woman goes through a surgery, a major surgery, which is, be it a C-section, be it a normal delivery, or pregnancy, there is something that she needs, which is rehabilitation, getting back to her normal life. And even in pregnancy, she needs a lot of help. So this is what is women's health physiotherapy. It is a different field in itself, and a very upcoming field, because it is more like a concept of a doula, like the foreign countries have it. So here we help women with infertility. We help women with PCOS, PCOD, we help them with pregnancy, we help them with antenatal exercises, postnatal exercises, breastfeeding, menopause. So for every girl, I can say right from the time they're born till they're, about to almost die. So everything comes under the umbrella of women's health physiotherapy.
Okay, interesting. So, I think puberty is a stage which not many people talk about.
Correct.
And they often feel that it's only, the coming of periods.
Correct.
Right? But, there's a lot more that goes before it and
Correct.
during it and after it. Can you throw some light on it and how physiotherapy can help?
So, I think many people are now aware that nowadays girls are hitting puberty very soon.
Correct.
They're getting your periods in like 10 years, 11 years, 12 years. Why is that happening?
Correct.
That is happening because of the lifestyle changes, because of the sedentary life. So I also see children, it really breaks my heart that 5-year-old, 6-year-old, full day they are spending their time at home with gadgets because the parents are busy or whatever XYZ reasons, because the play space is less in cities like Mumbai. There is no play area.
Right.
So they are just sitting at home, or maybe only on Sundays they are going outside. That is affecting their cycles, their hormones, their health. In the olden times, there used to be like खुले आंगन होते थे.
Correct.
They used to roam, they used to run, they used to have physical activity, they would also help in household work. So that is why they were very physically active. This inactivity is leading to puberty, and obviously screen time that is leading to so many other difficulties like autism. Virtual autism has become such a big thing now. So that is why if if a mother is aware and alert that I start physical activity for my daughter right from a young age, I encourage her to be physically active, I encourage cycling, I encourage swimming, I make sure that she's playing 1 hour in a day, she can definitely change her puberty timing.
Correct.
She can make sure that her hormones are in place and going up smoothly and not just flaring up like that.
Correct. In fact, now mothers are even more attentive with respect to the weight gain. पहले के ज़माने में they used to be like, our kids should be खाते पीते घर का, should be healthy looking, should be chubby. But now I think that has really changed. They want their kid to be fit.
Exactly.
And now because of that fitness being ingrained a little bit in the children, there's more swimming, more physical activity for both the genders, for both boys and girls.
Right.
Correct. So what kind of exercises do you generally tell girls at the age of 12, 13, 14 should normally do on a day-to-day basis?
So just play.
Correct.
I would not even tell them to exercise. Don't make them feel like my mom is making me exercise.
Correct.
No, just play. 1 hour of just run around, chupa chupi khelo, pakda pakdi khelo, kuch bhi khelo.
Correct.
Just run around.
Correct.
Don't be playing carrom, no, we played something on the mobile, we played Candy Crush. No.
Correct.
Go out and run. So running, walking is the best form of physical or cardio activity at that age. And they shouldn't even feel that, exercise karwa rahe mere se.
Exactly. In fact, आजकल there are group classes. So, I go for dance fitness, I go for, aerobics, weight training, but all of that is in group classes. So it doesn't feel like exercise.
Yeah, exactly.
And in fact, nowadays I'm even seeing 14, 15, 16-year-old girls come and, just do dance because they understand that later weight gain can lead to a lot of other problems.
Exactly.
It's not just aesthetics. Because I think previously it was all about cosmetic. You have to look a particular way to look beautiful.
Correct.
But now I think India is understanding the whole rationale of fitness.
Correct.
I think it's now very upcoming.
Yes.
Yeah. So, but if there are girls, say late puberty at the age of 15, 16, which also has become very common.
That is because of PCOD.
That is because of PCOD. So I was just going to come to that. So, what are some of the things through physiotherapy that you can help them with?
So, for girls who are hitting their late puberty or on the, higher risk of PCOD, PCOS, so it is also a bit of hereditary. So, if you are at a higher risk, if you have, juvenile diabetes, insulin resistance, or, some kind of things, make sure that your children are doing resistance training exercises. So, I have a research published in the International American Journal, in which I have proven that resistance training works very good for all the females who have PCOD, PCOS.
Correct.
So more than your aerobic, weight, cardio, it is if you are using your weights and therabands, that is your key to, heal your PCOD, PCOS.
Exactly. So resistance training in general at any age group is very, very beneficial.
And it is not, people think that I did cardio, it's enough.
Correct.
But at least 2 to 3 times in a week, you need to do strength training.
Correctly. Right from anti-aging. It's the best form of anti-aging. It is also the best form of losing weight.
Yeah.
Because what people don't understand is, okay, we are going to the gym, 1 hour we went and we are done. We lose weight. But it is resistance training that actually builds muscle the right way it's supposed to.
Exactly.
Correct. So that is something that helps with, girls. Another very interesting topic which I feel is now getting a little more importance is the sexual health in women.
Yeah.
Right? But yet nobody talks much about it.
Correct.
Say painful coitus or painful sex like we say. So many things they deal with. So what are some of the problems that you see on a day-to-day basis?
So painful intercourse is obviously one of the things. And it is all because of a tight pelvis. And when they have no information about it, they will go about asking everybody. And everybody will say, okay, initially it pains, it's okay. And that's why they dismiss the thing. But I get so many DMs, I get so many patients who say that I'm not able to conceive because of this.
Because it pains, then how can they
And
continue?
there is a term for it which is known as vaginismus.
Yeah.
And you need to treat it. You need to see a pelvic floor physiotherapist like us, like many others who are there, that who can show you the perfect exercises. We have something known as Kegel balls.
Correct.
Kegel's exercises. So we use those instruments to improve your I can say pelvic floor strength, and your vaginismus is just gone. So it's not that something that you have to stay with. Women are made to feel that this is normal. You have to bear the pain, but it is not like that.
Correct.
They don't have the right information that this is treatable with pelvic floor physiotherapy.
Correct. So if you have to understand the anatomy, physiology of it, can you go a little deeper in that?
So it is mostly because of a tight pelvic floor.
Correct.
To very basic layman language mein bolungi, when something's trying to insert, instead of the muscle getting loose, it is getting tighter.
Correct. Constricted.
So that is the whole game is of muscles over here.
Correct.
So once you train your muscles that when they should be tight and when they should be loose, and then that is just the key. So a simple Kegels exercise can just change everything for you.
Correct.
Same goes for incontinence. Many females, even young girls, even olds, though it's very common, they face incontinence. Incontinence is urine leak hote rehta hai. When they're laughing, coughing. In pregnant women, it is so common.
I was going to come to that, yes.
But basically, just do your Kegels exercise, which is just doing basic strength training of your pelvic floor, which is so easy.
Correct.
And you will be sorted.
Exactly. So, now that you got the topic of pregnancy and physiotherapy, I think this is now growing.
Yeah.
People have now started understanding okay, I need to do some minimal exercise.
Correct.
Probably not in the first trimester, but second and third.
Correct.
To also better prepare for labor.
Exactly.
But before we get into that, I have a very interesting question for you. I don't know much about garbhsanskar. Can you throw some light on that?
Yeah. So garbhsanskar is basically training your baby in the womb with all there are 16 sanskars in Hinduism. One of them is garbhsanskar.
Okay.
And it is not very recent. I'm sure all those who are Hindus who are listening must be knowing the story of Abhimanyu.
Correct.
Who in his womb heard about the Chakravyuh, and that's why he knew how to break the Chakravyuh. So that is mythological. It was so many years old. And now if you compare it with modern science, I can just say it is manifestation. And my own daughter is 5.5 months old now. She is the calmest soul I've ever seen, touch wood. So definitely it works. How is your nature? How are you in pregnancy? How are you dealing with difficulties that are coming with you? I won't say pregnancy is all easy. You will cry, you will feel sad, everything will happen. So what I hate is people think that garbhsanskar means मुझे पूरा time chanting करना है, जाप करना है, मुझे बुरे चीजें नहीं देखनी है, मुझे सिर्फ गीता महाभारत का पाठ पढ़ना है. It's not like that. It is about doing a lot of activities that will activate your right and left brain. It is a lot about connecting yourself in the womb. It is a lot about dealing with your own emotions. So, they asked me in the Garbhasanskar class, ma'am, can I watch a horror movie? I really love, but सब लोग बोल रहे कि नहीं बच्चे पे बुरा असर पड़ेगा. So I keep telling them, please watch. Please expose your child to every kind of emotion right from the womb, because this generation is someone who loves to fake it. Everything is fake for them. Everything is just Instagram for them. This generation doesn't want to show their true emotion. Even if they are crying the entire day on Instagram, they're putting lovely selfies. You should, in fact, as a mother, it is your responsibility that you train them that even if you're feeling sad, even if you're feeling angry, even if you're feeling happy, please share whatever you're feeling. Don't keep it to yourself.
Correct.
So I think that is the power of Garbhasanskar. I don't do it the traditional way. This is my way of doing it.
Understood. But if you could go a little in depth with it, if supposing I enroll, say, for your class of Garbhasanskar, and I'm, say, first trimester, what exactly can I learn and what are its benefits to the baby?
I basically believe it's just basic principles that you need to understand. What are the activities that you need to do on day-to-day basis. There is some meditations which you need to do every day, or some chants that you need to hear, particular ragas that you need to hear month-wise that have a positive impact on the baby, how to deal with your emotions, how to deal with your relationships in pregnancy, because obviously you get very angry and irritated with your husband, with your in-laws, etc. So how to deal with those emotions, how to deal with the body changes, all of that comes under the radar of Garbhasanskar. So right from your first trimester, so some people ask, I'm already 32 weeks, what's the point now? It's not like that. Even if you're 1 day left to deliver and if you still want to learn, I will tell you that meditation is so powerful. When I take that meditation in the class, everybody has tears in their eyes because it just feels so, I have no words. It's just a feeling that you feel connected, and it's more of a manifestation that I teach. and it works for many. If you read the reviews on my page, you will see, if you manifest that, I will have this kind of delivery in this kind of room and whatever, it does happen. And now even science believes in manifestation. So we Indians call it garbhsanskar, they call it manifestation, but hai wahi hai.
Okay. So you said that now even the people are believing in manifestations, right?
Yeah.
But is this something that has strong research behind it as well, or is it still in that phase?
It is still in that phase, but obviously it is proven. I think almost everyone subconsciously believes that yes, it is there.
Okay.
If there is good, there is evil also.
Correct.
So if you manifest something, it does happen. And I don't tell everyone that whatever you think 100% वैसा होगा. Even if 50% of that happens,
correct,
why not? Like I myself had a cesarean, emergency cesarean section. Of course, I never thought about it.
correct.
But when it came to me, I was not someone who got like helter-skelter, that oh my god, and what happened and why. Garbhsanskar is a tool which will make you calm, that okay, because I always say one line in my class, it is the child who decides when and how they want to come. You are not God. You can't decide that. So if you keep fighting with yourself, then no, I have done exercise 9 months, ऐसे कैसे cesarean section होगा, normally होना चाहिए, why this happened to me, then that is something wrong that you're doing to yourself and your baby. You will affect your breast milk supply with that stress.
Understood.
Just let it be. Okay, my baby chose to come early. My baby chose to come via the abdomen. His or her choice. Let her come the way she wants to come. She's welcome.
Can you take us through any one example or one patient story that was really positively impacted by garbhsanskar?
Yeah. So there is one patient. I don't know if I can take her name. She's Prerna Nigam. I'm taking her name. I don't know if she'd be okay with that. So she's Femina Miss India, I think some year. She's in Delhi. She had taken my garbhsanskar class, and she, had her house shifting at the end of her third trimester, and she always told me, I don't want the delivery to be early because otherwise it is going to be very hodgepodge. So I used to tell her that every day in the meditation, you just tell your baby, please don't come early. Mama has some shifting to do. She did that. 40th week, the day it was her 40th week, I messaged her in the morning, see, you reached 40th week and everything is good. Within 1 hour, she went into labor, she had a delivery and the baby was here. And she was like, I couldn't believe myself that exactly this is how I had envisioned my hospital room. My husband would come, this would happen, it would be my 40 week, and exactly picture perfect how. Even I am surprised. So she told me that, I also told my doctors that, my doctor had told me that nahi hoga if you believe it. This is one. Another is one patient, her husband was overseas. And she told me that I don't want that delivery to happen in his absence. But due to some reason, she had early labor pain. So then also she messaged me. I said, don't worry, you keep talking to your baby. So something happened and things were stabilizing. The husband got a early flight, and in 1.5 days, she was still in the hospital. The baby only delivered once the husband entered the hospital. So she literally had tears in her eyes, and she had written down everything to me that I don't know how, but this happened.
Okay, interesting. So garbhsanskar starts from when exactly? I mean, the ideal time to start it is when?
So you can also start it before pregnancy. Okay. So it is, like I said, it's just a tool to help with your mental health.
Correct.
So the earlier you start, the better. But I usually prefer to take it in the third trimester.
Okay.
Because in the first 2 trimesters, you're already dealing with nausea, vomiting, body changes. So you are not actually in that frame to connect with the baby in the womb. I genuinely and personally also, I felt once you're in the 6th, 7th month, you start feeling the kicks. That is the time that you will actually do it. Other times you are just doing it, achi ke bola hai, main kar rahi hu.
Correct.
But once you are in the third trimester, you feel the kicks, you feel those emotions, and that is the right time to bring it in tune with yourself.
Understood. So, like you said, that first, second trimester, they have a lot of other issues.
Yeah.
One very common issue during second trimester is also backache, body ache,
Yeah.
And of course, some exercises, which of course, once the gynaec approves, can be done and should be done.
Yeah.
But are there any 1 or 2 exercises that will benefit?
Yeah, definitely. So there are 2. One is pelvic tilts and one is the cat-cow pose. There is also the butterfly pose. So, touch wood, I never had any back pain in my pregnancy. That is because right from the start, so it's a myth that you can't exercise in the first trimester, by the way, unless you have a low-lying placenta. You can start exercising, you can start very mildly under the guidance of someone. Correct. Please don't watch any random YouTube videos and start doing something. Correct. Every pregnancy is special, every pregnancy is different. So we physiotherapists customize the exercises according to your body type, your pregnancy, how is your placenta placed, how much is your AFI, and how is the baby's growth. Depending on that, we customize that, this. But if you want to ask me 2-3 safe exercises that everybody can do: pelvic tilts, cat and camel, Kegels, obviously.
So they generally just strengthen your pelvic floor, correct?
Yeah, and make the pelvis very mobile, so you will not have back pain.
Okay, understood. Interesting. Okay. So, another thing that I was seeing in your profile was that you're a Lamaze educator.
Instructor, yeah.
Yeah. So can you throw some more light on what exactly that is? It's very common in the West, right?
Yeah, it is. It is.
And it's now building in India.
India, yeah. So this is, of course, like a doula institute.
Yeah.
So we have, in India, we have Kappa, we have Lamaze. I have done Lamaze. So Lamaze is what teaches me all this birthing and all that. So women's health physiotherapy teaches me with all the exercise part and all of that. But Lamaze is what guides me in more of the breathing exercises, the post-delivery lactation, and how to help a mother in pregnancy, the nutrition, all of that comes from Lamaze.
Okay. So what are these 1 or 2 breathing exercises? Because I know in the third trimester especially, we really tell them to learn it.
Yeah.
Because it's very beneficial during labor.
Exactly.
So can you tell 1 or 2 of those exercises which women should start, say, from the second trimester itself?
I would say even before you start getting pregnant, you can start Anulom Vilom. It is very easy. It is very basic. It is just a good control. मतलब if you want me to explain, तो एक नाक से सांस लेनी है, hold it for a few seconds, leave it from the other nostril, take in again from the same nostril, hold it for a few seconds and leave it. इतना simple है, इतना powerful है और इतना calming है. And another very good for pregnant women is, just doing this humming, just doing this buzz sound. It is a breathing which will, just cancel the voices in your head.
Okay.
All the stress, all the tension. Whenever you're feeling very, tensed and all worked up, just do and your brain will be like calm.
Okay. So if some women really want to incorporate all these things, right? Can you chalk down a routine that they should follow, during pregnancy? When should they start? How do these exercises, where should they incorporate that in their time? How should this be done?
So for working women, there is no schedule. Obviously, they're working 9 to 6. And I was also working till my 9th month, and I absolutely suggest that. There is, unless you have a, you can say, high risk pregnancy, कोई ज़रूरत नहीं है कि आप बिल्कुल बेड रेस्ट करो. और the more आप जितना लेट के जितना आराम से pregnancy निकालोगे, that much difficult it will be for you.
In fact, we even suggest women to don't, because that is bad for the blood supply, the blood circulation in the child. So it is absolutely, unless it's a high risk pregnancy and your gynec has told you, you need bed rest, it's absolutely against. Exactly. Also, that increases obesity. Already women, because of the different cravings that they have, the weight gain is just not measured. It just keeps on happening,
and they are very happy with it.
Exactly. Exactly.
And then the child is also born very obese, which they are very happy, and then they will be like, after a few years they'll be like, ab isko patla kaise karu?
Yeah.
So my daughter is very, like very thin looking. People are more bothered.
Correct.
Isko khila, isko mota kar. And I'm like, yeah, okay.
Correct.
Okay, fine.
And in fact, losing that weight, in the postpartum is
so
even
hard.
more difficult. It is an absolute struggle.
Exactly.
And by the time you've become comfortable with the baby and everything, and you want to resume that, a lot of women in India, they get their second pregnancy.
Correct.
So that one pregnancy weight gain, then another pregnancy weight gain, and it becomes a cycle, which then gets difficult for them to then lose weight.
So since we're talking about weight gain and weight loss, there is something known as diastasis recti, which I'm sure you're aware of. So we also take those classes. We take core correction classes. So that is once you deliver, once you have finished your 40 days of japa period, you need to get your core corrected.
Correct.
वो कोई heavy exercise नहीं है. It is just simple exercises. I can say 10 exercises that just help you in bringing your core back, bringing your rectus muscle back to where it was. और कोई दवा खाने से, कोई weight loss program करने से वो नहीं होगा. You have to work on your core.
Correct.
Once your core is strengthened, you can go for second pregnancy, you can go for weight loss, you can do whatever you want. But 40 days after delivery, you can do it. Okay, so the next question comes, what if I'm already 2 years post-delivery? Now what? You can still start. Whenever you start, trust me, in 21 days, your diastasis gap will heal.
Very true.
Because your muscle has memory. So once you start working on your muscle strength, you start working on your DR gap, it recovers and automatically वो जो flab लटक रहा है वो फिर से अंदर चला जाएगा.
Exactly. But you know, if someone wants to start, you know, after 40 days, like you said, yes, and we generally say that the golden period after 2 weeks of pregnancy, they should start some or the other good physical activity.
Yeah.
Right? So what are these 1 or 2 things that they can genuinely start doing?
Walking is the most underrated thing. Correct. But I definitely suggest, even in the first trimester, even in fact in my 5th week, 6th week, everybody will suggest कि अरे घर पे बैठे रहना चाहिए. I would definitely suggest just go for a 10-15 minutes of walk, brisk walk. Just go in the open air and walk.
Yeah,
that is the most basic thing that you can do.
Correct.
And second is breathing exercises. So even if you are the highest risk pregnancy, just basic 10-15 minutes of walk, breathing exercises, upper limb exercises, because trust me, you will thank yourself once you start breastfeeding. Your shoulder muscles need a lot of strength. So yes, you can start those 2-3 things in your first trimester.
Interesting. So, you know, like you're talking about post-labor now, post-delivery. Cesarean scar is something which is one of the most painful things, right? Of course, it is getting better now with the new kind of sutures that have come up. Right? But is there anything that you as a physiotherapist also can help through something?
Yes. So there is something known as scar massage, which we teach in the 6th class, which is the postpartum care class. So if you massage your scar carefully after delivery, you don't let it stick or adhere to your skin, you will not have all those stitch issues or scar issues. And frankly, nowadays with the sutures in 10-12 days, they dissolve on their own.
Correct.
Nothing happens.
Correct. So it's become better, of course, but you're saying some of these exercises can help.
Yeah.
So walking, you're saying, is the best thing, but I think that in general for anyone's fitness is very important.
Yeah, but especially for pregnant women. Why? Because your blood circulation is at stake, because now you have to pump blood for 2.
Correct.
So if you don't walk around, if you remain stagnant, then in the 7th, 8th month you will come with पैर में सूजन आ रही है, पैर में सूजन आ रही है.
Correct.
पर आपने पहले 3 महीने सिर्फ बैठे बैठे निकाले, फिर पैर में सूजन तो आने. And second very important thing in physiotherapy, we emphasizes posture. So once you're pregnant, you feel मैं ऐसे बैठूं, कैसे भी बैठूं चलेगा. That will definitely affect your placenta position. That will affect your AFI, that is the amniotic fluid which is there around the baby's growth.
So can you throw some light on these common topics that you generally discuss on? 1-2 exercises जो genuinely, supposing for whatever reason आपका class नहीं join कर पा रहा है, वो अपने घर पे, someone is saying tier 2, because I think there's a lot more access to information in tier 1 standing.
On the contrary, I would say my classes are joined by most of the tier 2, tier 3 cities all over India and the world.
Okay.
Because I think tier 1 people maybe rely more on YouTube or just some information.
Okay.
Tier 2, tier 3 people are genuinely interested, who want to learn. And they are so I'm very happy about this thing that even the husbands attend all the class these days.
Okay. Yeah.
They are equally interested that what is my role? What can I do? How can I help her in the exercises?
Correct.
All of that. So it's really amazing. So if you are someone who can't join for XYZ reason, there is no problem. I put all kind of information already on the gram. And even if you're not accessible to that, I would just suggest you that walk, do your breathing exercises, connect to your baby, speak to your baby for 5 to 10 minutes every day, do your upper limb strength exercises, and of course manifest everything good and keep your mental health above everything else. Physical health is secondary. In pregnancy, mental health is everything.
Correct. I think, this brings to a very interesting topic of course, depression during pregnancy, but even after, which we call as postpartum depression, which is very common. Do you think it's on a rise?
It is on a rise. No, it was always there, but now it is noticed. Now people are aware that, okay, this is what is happening to me. पहले भी होता था, but they were just dismissed saying कि तू पागल हो रही है.
Okay. Actually, पहले तो उतना value, मतलब इतना फोकस नहीं करते थे
फोकस नहीं
on the
करते
woman's
थे
health,
मेंटल हेल्थ पे,
mental health पे,
और
exactly.
वो दैट वुमेन वुडंट इवन हैव अ वॉइस.
Correct.
अगर मुझे डिप्रेस फील हो भी रहा है,
किसको बताएंगे,
किसको बताऊं,
करेक्ट,
किसको कहाँ बताने जाएगी वो कि मुझे क्या हो रहा है.
हम्म,
They're not allowed to talk. They were not allowed to meet their husbands, I think, for 1-2 months and all that. So बहुत सारी चीजें हैं इंडिया में.
okay. Can you
But
throw some light on these? Are these practices in urban India or rural India?
रूरल इंडिया.
तो थोड़ा बताएं इसके बारे में.
So obviously the Java period उसी के लिए होता है कि the pregnant lady is sent to her mother's house and she's kept in a confined space. She's not allowed to meet people. She's not allowed to go down. So 40 days you're not allowed to go down. You're not allowed to go outside your house, which I believe is a ritual that had started because maybe that is because the woman is at the risk of infection.
Correct.
Her immunity is low. But people don't understand that if I keep you confined in one room for 24 hours, how will that feel?
Exactly.
If I keep you confined for 24 hours with only dal and khichdi and hot water, how will that feel?
Exactly.
जेल के कैदी जैसा उसका ये बना देते हैं और फिर बोलते हो कि ये तो रोती रहती है. क्यों रो रही है वो? You look at what you are doing. What are you giving her? She is tired. Her body is paining. Cesarean stitches are one thing. The body weakness is crazy. She has to 24/7 feed the baby, pick up the baby. She's not able to figure out what the baby wants, and the maternal instincts drive you crazy at another level. Or every time the baby cries, you feel like crying that, oh my god, something I did wrong that she's crying. Because the people make you believe that.
The people blame you for everything that goes wrong with the baby.
तूने मिर्ची खाई ना, बच्चा रो रहा है. तूने ये खाया ना, बच्चा रो रहा है. तूने ऐसा किया ना, बच्चा रो रहा है. Exactly. So the mother is made to believe that whatever, and this is now I'm talking about newborns. Once even the baby is older or even a toddler, every damn thing that happens to the baby, तूने ध्यान नहीं दिया होगा. The mother is to be blamed for each and everything.
Exactly. And all of this then leads to a depressive mind, which we then call as postpartum depression.
But I think it mainly roots, because I personally felt it now also, it mainly roots to if you're not able to vent out, if you're not able to vocalize what you feel to your spouse or to anyone, then that is what triggers everything.
Okay.
आपने बोल दिया, बता दिया, बात खत्म. It's gone.
Okay.
But if you keep holding it inside yourself, then it just gets accumulated and one day there is a bomb blast and people think, oh, कितना रो रही है, कितनी पागल हो रही है. अकेले तूने बच्चा पैदा किया कि हमने भी किए थे, इतना क्या रोने की बात.
Correct. So in this entire state, what do you think is the importance or contribution of the father?
So the fathers, like I said, listen. Don't do anything. सिर्फ जो बोल रही है ना वो सुनो. She doesn't want your suggestion. Don't cut her conversations. At least let her speak. I've seen so many husbands, even before she starts speaking, अरे तू क्या हर वक्त उसी चीज पे रोती रहती. पहले सुन तो लो. उसको नहीं रोना है. तुम सुन तो लो वो बोलना क्या चाहती है. Let her just voice what she's feeling. Let her just remove it from her system.
Exactly.
At that point of time, you may be her punch bag, but please be one. Let her just remove her frustration.
Exactly.
Don't give her any opinion, nothing. Just acha, okay. That much also will be more than enough for
Exactly.
her.
I think also another problem is that they want to be of the solution mindset.
Yeah.
They want to help, so they start thinking of solutions. Even when the wife is speaking and giving her concerns out loud, speaking it out loud, they're in the solution mindset. But at that time, I don't think the woman wants the solution.
Exactly.
Because most of the times, it's going to be a very common solution, will be a logical solution.
And she knows the solution.
Yeah.
She just wants sympathy at that point of time. Genuinely.
Correct.
Genuinely. Every woman wants to be pampered in pregnancy. It comes from a very basic insecurity. In fact, even I had it, and there's no shame in saying that. And the day I was going to deliver, I remember telling my husband that, you will not forget me after delivery, I will still be the first important person for you. I remember I had tears in my eyes and I was asking, he was like, pagal ho gayi? Tu kya bol rahi hai? But it is, I don't know, it is a feeling which every, I think, women goes through, that maybe now the focus will shift from me to someone else.
Exactly. I think also the focus, but also because women change so much bodily.
Yeah.
There is tremendous change.
Yeah.
The way you look.
So I think that every husband should understand.
Correct.
That she sees herself through your eyes.
Correct. For those initial 40-60 days.
I think forever. I'm 5.5 months postpartum, but I'm still not confident. I'll always, am I looking okay? Just say yes. What's the big deal?
Correct.
She's always going to see herself through your eyes. If he's saying I'm looking good, I'm looking good.
Yeah.
She doesn't need validation from anybody else.
Correct.
So I think if you are going to tell her that कैसे बाल हो गए हैं, कैसी स्किन हो गई है, कैसे breakouts हो रहे हैं, फिर breakout हो रहा है. Trust me, she will start crying.
Exactly.
So just be a little gentle with your words.
Yeah.
She might be a little cranky. She might become a little chidchidi. She might, shout at you for little things that you're doing with the baby, because it's just a maternal instinct that kicks in के कुछ harm ना हो जाए उसको. और husbands को ऐसा लगता है that she's trying to overpower me. My child also, I also know what to do. But just try to understand that this is a shift of hormones that is happening. And if in this time you break the intimacy, which I think one mistake many husbands do, they break the intimacy. They don't want to be intimate with their wives. They don't want to, just basic hugging also. So underrated. But, women start feeling that he's not even hugging me. It's been 5-6 months. Maybe I've become too fat. Maybe I'm looking that bad now that he doesn't even want to look at me.
Exactly.
So it is such a simple gesture. But just do it for the sake, when you come home and you come and play with the baby, you give the baby a peck. Give your wife also one.
Correct.
That she also feels that, okay, I am also still his old wife and not, just his child's mother.
Correct. Exactly. I think that because the entire 9 months you were someone and you keep struggling to become something because the elders of the family keep saying, and even after that their suggestions, their opinions do not change. They'll in fact keep on growing.
Correct.
Do this for the child, do that for the child. So everything is now about the child.
Correct.
And very beautifully you said that the intimacy should not stop. But here I also want to ask you, how can fathers improve their bonding with their children?
I think
the newborns.
It comes naturally. I genuinely feel. Of course, it takes some time. Mothers will be like motherly in like 1 hour. Husbands do take their time, maybe 2 months, 3 months. But women, I would give this message to you: don't get paranoid. He's not connecting with the baby. ऐसा नहीं है. After 2-3 months, you will see he's connecting more with the baby. Once the baby starts smiling, cooing, you will definitely see the shift. And so even fathers have that instinct, but just give them a little time. They will get there.
So if you were to tell, say, the fathers to be, because I really feel there's everything around the woman. There's every information, misinformation, opinion is all given to women. But I think today's men are equally confused. They want to participate, but they don't know how to participate. So if during pregnancy and postpartum, the three things you can tell that y'all should do this. Like a starting block on how they can show that they're equally interested in the whole phase. What would that be?
First, in pregnancy, I would say, first, eat healthy with her. Don't make her feel कि तुझे अकेले को ये सब खाना है. मैं तो जो चाहे खा सकता हूँ. You are pregnant, I am not. You also switch to eating whatever she is eating. Help her in that. You also start moving around or walking or exercising with her, so that she does not feel that ये मैं अकेले क्यों कर रही हूँ. Make it a group activity. Have fun.
Very true.
In garbhsanskar, I always include one activity, which is playing board games or any kind of games with your husband before bed. Now, why is that? Because games like chess or something, they help in brain development. Sudoku, Scrabble. 5-10 minutes play with your wife. She will also feel you've given her quality time. And you are actually bonding with the baby and improving the right brain and focus of the baby. Correct. So win-win situation. So you can play with your wife. You can go for a little exercise. Have something healthy. Once in a week, at least take her down for a walk or a coffee. She will love it.
Interesting. And similar things during postpartum as well?
Postpartum, I think even more. If she's eating khichdi and dalia, don't feast around with her.
Correct.
That's a no. Second thing, make sure when she's breastfeeding, you're bringing her a glass of water. You feel very thirsty while breastfeeding. Such a simple gesture, but she will really love it that when you're breastfeeding, you're offering her water or some light snacks, because when you breastfeed, you feel very hungry, you feel very thirsty.
Correct.
Thirdly, if you feel she's staying up whole night and she's breastfeeding, at least help her with diaper changes or burping the baby. That is some basic chores that you will do. she will appreciate it. Even simple diaper changing, or waking up a little bit early than her and play with the baby till she gets ready with the daily routine, and then feed the baby. You are handling the baby. So much you can do.
Correct. And you spoke about lactation, and I think you also
I
teach
take breastfeeding,
lactation,
yeah.
breastfeeding classes, right? I think that is something which women are not very well aware of.
Yeah.
The latching technique and the
Right,
whole
right.
understanding of lactation. So, do you want to throw some light on the best way to breastfeed in the most efficient manner?
Use a feeding pillow. I think that also I'm surprised many people don't know nowadays. But ergonomic breastfeeding pillows, use them, you will not have back pain. लोग ऐसे बोलते हैं अरे बैक पेन तो होता ही है, ब्रेस्ट पेन तो होता ही है. क्यों होता ही है? It's a very natural process. नहीं होना चाहिए. Use a proper breastfeeding pillow. Sit properly. Keep your arms supported. Choose a chair where you will sit and breastfeed. Choose in your comfort position and feed. एंड डोंट वरी अबाउट अरे ये दिख रहा है वो दिख रहा है, ढकना चाहिए, किसी को दिखना नहीं चाहिए. फीड इन योर कंफर्टेबल स्पेस.
करेक्ट.
एंड ब्रेस्ट फीडिंग 1-2 दिन में नहीं आ जाता है, सो डोंट वरी अबाउट दैट. दूध नहीं आ रहा है, दूध नहीं आ रहा है. 1-2 दिन में you don't develop that much breastfeeding. It takes time. The baby has to understand you. You will understand the baby. In 10-15 days, you will get a hack of it, and it will be like a cakewalk. Yeah. So don't worry so much about it. If you have flat nipples or inverted nipples, use nipple shields, get support. Don't think so much over कि दूध नहीं आ रहा है, फॉर्मूला दे दूँ, फॉर्मूला दे दूँ. और बाय चांस अगर फॉर्मूला देना पड़ रहा है तो विदाउट एनी हेजिटेशन दे भी दो. Don't drive yourself crazy behind, oh my god, my milk is not coming now.
Correct. So like how I explain to patients that in the breast there is a nipple and the darker area around it called the areola. Right. The entire thing needs to go in the mouth. Other techniques that you also teach for better and efficient lactation?
Yeah. So your chin, the baby's chin should touch your cheek. The lips should be in a pout, and you will hear a continuous sound.
Okay.
And make sure the baby's nose is not getting pressed. It has an airway to breathe.
Okay. And when the babies, they start that gum development and the teeth development, that's I think the most painful time for the woman. So is there any 1 or 2 techniques that they can use to somewhere decrease the pain?
The teething, yes. Yeah. So you can take a soft muslin cloth, dip it in breast milk and refrigerate it, and just give the baby to chew it. They'll feel a lot soothed. You can also dip your finger in cold breast milk and just give her a little gum massage. And otherwise you can also obviously use neem teethers. That will also help with teething.
Correct. I think postpartum lactation becomes one of the biggest things, but urine incontinence and the heaviness, the bladder heaviness is another thing, and can lead to smaller discomforts, urinary incontinence, to even prolapse. Correct. So what are some of the things that they could do better to prevent all of these problems?
Pelvic floor health. So that is something that you should start Kegels immediately after delivery. Immediately means 3 से 4 घंटे में आप Kegels start कर दो. आप pelvic tilts start कर दो. And like I said, core correction after 40 days, that is like unnegotiable. वो करना ही है. Even if you have not taken any of my sessions, don't even take my core section, but please go on YouTube and search diastasis recti exercises and do it for yourself. It will just heal your pelvic floor, your abdominal muscles, everything.
So, doctor, we covered pregnancy, we covered puberty, but one phase of every woman that generally is not spoken about is menopause. Right? So, can you throw some light on menopause? Do you deal with such patients as well? And what are the exercises you recommend?
Okay. So menopause, first of all, this is for all the audience whose mothers may need this. That, how do we know that your mom or someone in your family is going through a menopause? So obviously periods aana band ho jayenge is very obvious. But there are other bodily changes, like her body will start paining more, hair fall hoga, skin changes hoga, irritation hoga, hot flushes honge. So if you feel, if your mother or any near or dear one is going through all this, she's going through a menopause. And again, it is a very difficult phase of life because suddenly her body is shutting down all the hormones that have been making her dance from past 40-45 years. So it is a very difficult phase. Now, how do you tackle this? So if you will tell your mother that you need to exercise now because you're in menopause, she will tell, मैंने पूरी जिंदगी काम किया है, मैंने इतना काम किया है, अब वो exercise भी करूँ. I'm already tired. I don't have the time. I have so much work. जस्ट टेल हर एक्सरसाइज मत करो, अपने लिए टाइम निकालो, आप सिर्फ कोई योगा क्लास ज्वाइन कर लो, आप सिर्फ कोई वॉकिंग ग्रुप ज्वाइन कर लो. यूज योर टाइम फॉर योर सेल्फ. यू हैव गिवन 40-45 years to us, no? Now just give these few years to yourself and your body. Talk it in this way. Don't tell okay, नहीं नहीं exercise तो करना ही चाहिए आपको. So menopause hits very badly. You will feel as suddenly my mother has become so chidchidi, but the reason is she's going through a menopause. As children, we should understand this and help our parents that, just take out some me time, just go for a little walk, maybe join some group, go for Zumba, go for yoga, whatever you like, whatever passion you have left in your life because you had to take care of children.
Correct.
Just go back to that.
Correct. But if someone who is interested in learning something what they can do at home, what are the top 3 exercises you would recommend?
For menopausal women, I will also recommend yoga exercises, that is flexibility exercises, because most of the body pain starts because your body has become not so flexible now. So very basic yoga exercises like bhujangasana. Yeah. So अगर आप सिर्फ सुबह उठ के 10 भुजंगासन करेंगे, आप सिर्फ थोड़ा सा अश्विनी मुद्रा करेंगे, that is for incontinence. Bhujangasana is for your back pain. If you will do a little bit of just basic stretches of the upper neck and upper limb, it will help all the menopausal, even the dads, in fact. Thoda sa sirf, so once you become menopausal, your focus of exercises should be on the flexibility.
Correct.
Not the strength, not the cardio. It has to be flexibility.
Exactly. Even the calcium absorption delays, right?
Yeah.
So that leads to a lot of bone and joint pains
Correct,
and
correct.
aches all over.
Correct.
So in general, just moving your limbs becomes
just
very important.
Like I said, because over the years, the posture is going to get affected.
Correct.
I think every day 5 new patients of back pain. Back pain. All ladies will have back pain, neck pain, back pain, neck pain.
Correct.
Because तुम रोटी बना रहे हो झुक के आज इतने साल हो गए. Very simple remedies. ओटला थोड़ा ऊपर ले लो, पोलपाट थोड़ा लंबा वाला ले लो, बैठ के रोटी बेलो. Basic छोटी changes आप कर लो, you will be sorted.
Correct. So apart from these exercises, what else on an emotional side actually helps women during menopause?
Connecting with other women. Okay. I know kitty groups are, literally blamed nowadays, but trust me, nothing works like it. I have my own reborn pregnancy support group. I have a mom support group. It's wonderful how women help each other. We are in this era that women help women.
Correct.
So if you have a circle, if you have a group where you can even just sit and maybe bitch about your sister-in-law or your daughter-in-law, you will feel so fresh for the entire day. Don't stay alone. Kids do get busy in their own lives. They won't have so much time. Find your own circle, find your old girlfriends and just sit with them, talk, move around, go out for trips with them. You will feel so much better.
Understood, exactly. So the last section of this, I'd like to ask you a few questions which I call the rapid fire section. So the first one is, one myth that you would like to debunk about childbirth.
There are many myths here. Childbirth. It's a myth also कि तुमने exercise नहीं किया इसलिए तुमको cesarean हुआ, because you are very lazy. You're not ready to take the pain. But the doctor, so one myth is on us also कि doctors तो जानबूझ के cesarean section ही करना चाहते हैं.
Okay.
So that I think all of this is just rubbish. If we are doing cesarean, we are trying to save lives. Please understand that पहले इतने cesarean नहीं होते, but पहले deaths कितने होते थे?
Exactly.
So we are just trying to prevent the deaths.
Correct.
Please understand that it's a myth that
Correct. In fact, many people don't understand that vaginal or normal delivery is very uncontrollable.
Yeah.
You can't control it.
Can't control.
The female could be in labor pain, but there are so many other things that could go completely wrong.
Exactly.
Which would lead her to an emergency cesarean section, right? The descent of the baby would not happen because of the circumference of the baby, the diameter of the baby is correct. The contractions would be there, but not of the adequate intensity that is required. Correct. Sometimes other medical conditions lead the doctor to say that, it's better to do a cesarean.
Correct.
Also, postpartum hemorrhage is something which is very common.
Exactly.
Which is significantly reduced because of
Stitches
cesarean. Stitches is cesarean, of course, but in normal,
even in
the perineal, the episiotomy scar, exactly. So a couple of these things can definitely be saved.
Correct.
Yeah, so I truly agree.
So both are equally difficult though. Even if you're having a normal delivery, it's not that it's all a cakewalk. It's maybe अपना part of है.
Correct.
तो ये सब myth है कि ये normal delivery आसान है, cesarean आसान है. That's a big myth.
Correct.
Both are equally difficult.
So my second question is, what's your favorite relaxation technique to recommend to expectant mothers?
Just go down, and if you find any greenery anywhere, better is of course any sea face or anything. Just go down and sit there for 5 minutes and Om chanting. If you do it, so any religion can do it. Okay, so if you're a Hindu, do Om. If you're a Muslim, you can do Ameen, and if you're a Christian, you can do Amen. But just do those chanting 5 chants, and you'll be in another space.
Okay. So the third one is, what's one piece of equipment you believe every new mother should have at home?
Breast pump. That is, I think, very important nowadays. Even if you're working, even if you're not working, even if you're a full-time at-home mother, a breast pump is something that can save you a lot from engorgement. And one more which I will add is a nip care cream, because many people feel children do bite. Okay, and then they feel कि दर्द हो रहा है तो ठीक है, कोई बात नहीं, you can just apply a simple nip care cream and the pain will go away.
Yeah, exactly. I think that is very important. And again, there's no awareness around these things.
Correct.
There's just nothing that's been told to the mothers. You meet a lot of expectant mothers on a daily basis. So what is that one fear you see is common in all of them?
दूध नहीं आएगा, दूध कम हो जाएगा, बच्चा भूखा रह जाएगा.
Okay.
मुझे कैसे पता बच्चे का पेट भर रहा है नहीं भर.
So what is it that you tell them?
So I tell them, अगर वो दिन में 5 बार सुसु कर रहा है, 1 बार पॉटी कर रहा है, या 3-4 दिन में 1 बार पॉटी कर रहा है, ग्रो बराबर हो रहा है, तो उसका पेट भर रहा है. They are not crying for food, they are just crying for time pass. बैठे बैठे क्या करें?
So what should be the ideal lactation routine a woman should follow?
Oh, there is no ideal routine you should follow, but yes, please feed on demand. This is a myth again that you should feed every 2 hours. बच्चा सोया है उसको उठा के पिलाओ. Imagine you are, if your father is coming every 2 hours, चलो eat something, चलो eat something. Will you like it? Obviously not. It's a newborn baby, अंदर सो रहा था 24 hours, तुम अचानक उसको 2-2 घंटे में उठा के दूध पियो. Initial 10-15 days is okay till the baby gets a hang of the breastfeeding, but after that please switch to feed on demand.
Okay. Because on the contrary, what we often tell our patients is to inculcate discipline. To inculcate discipline. So if supposing you're giving, say, at 10 a.m., then you're giving, say, whatever you've observed patterns. Observe patterns, but then make it a discipline habit. So if you've observed कि ये 10 बजे उठ रहा है, फिर से 2 बजे उठ रहा है, फिर से 6 बजे उठ के he wants milk or she wants milk, then you should continue that timing. But then what do you think about this?
But I don't think any child follows a timetable.
We should inculcate that, right?
We can't inculcate that. Every child, so today I'm feeling happy, today I'm moody, tomorrow I'm feeling very hungry. So don't we all have our days that, today I'm feeling very hungry, I want to eat. But tomorrow I'm just not in the mood, I don't want to eat. But Jabardasti, you will come at 6 o'clock, then no, you eat every day at 6 o'clock, you have to eat.
Okay.
How does that feel?
No, but just imagine if, you as adults, if we as adults also, someday we are having our dinner at say 6 p.m., someday we are having at 8 p.m., someday we are having at 12 midnight. Your body will react.
Yeah.
And to a newborn also, he's still figuring, okay, what is happening.
But
so of course, once it's figured, after 6 to 8 months, there should ideally be
after 6 months, so of course, once they start their solids, then of course they have a routine of lunch,
correct,
breakfast, dinner, 2 snacks. So वो तो होने ही वाला है 6 महीने बाद.
Correct.
But till they are on feeding, so some feeds they take 30 ml. So if you stick to that, अरे यार ये तो रोज सुबह 60 पीता था, आज 30 पी रहा है, कुछ गड़बड़ है. ऐसा नहीं है.
Of course, that I agree. If you could implement one change in the prenatal practices in India, what would it be?
Start exercising. I don't know why Indian doctors and doctor-in-laws are made to believe exercise करने की क्या जरूरत है, घर का काम कर वही काफी. घर का काम और exercise बहुत अलग चीजें हैं. Exercise is something that will also release your happy hormones, and that is why we are doing it. So please exercise in pregnancy.
Correct. And the last question, what is that one advice you would want to give all expectant mothers?
Believe in yourself. I'll tell you, the world will come to make you pull you down, that you won't be able to do it, it is so difficult, abhi so ja, baad mein sone nahi milega, etc. You will get one advice from every person, even a layman, walking in the lift or on the road, someone will have some advice for you. Just believe in yourself. The soul has chosen you for a reason. he or she knows that you are the best mother for them. So please believe in yourself that whatever you will do the best for the child, and you will not harm your child no matter what. So trust yourself and believe in yourself that you can do it. Every mom can do it.
Yeah, exactly. So thank you, doctor. I think it was very insightful, and I'm sure everyone's going to learn something from this.
Sure.
So thank you. Thank you for being a part of the Body Talk. If you found this episode insightful, don't forget to subscribe for more such interesting conversations. Also, keep listening to your body because it does talk. Thank you.